Hi everyone. In this presentation, I will describe the popliteal fossa under the headings of introduction, boundaries, contents, and clinical importance. Popliteal fossa is a diamond or rhomboid shape intermuscular space situated at the posterior aspect of knee joint. It becomes more prominent when the knee is semi-flexed. It is anatomically significant as it provides passage for major neurovascular structures to pass from thigh to leg. Now let us discuss the boundaries of the popliteal fossa. To understand this clearly, let us first draw the femur. So this represents the posterior surface of femur. Below it, we draw the posterior surface of tibia, and laterally we have the fibula. So, hence this side represents the lateral aspect and this side represents the medial aspect. Now, let us outline the popliteal fossa, which is diamond or rhomboid in shape. So, the popliteal fossa is bounded superolaterally by long head of biceps femoris, superomedially by semimembranosus and semitendinosus, inferolaterally by lateral head of gastrocnemius and plantaris muscle, inferomedially by medial head of gastrocnemius muscle. The roof or the posterior wall is formed by skin, superficial fascia and deep fascia or popliteal fascia. The superficial fascia contains sural communicating nerve, short saphenous vein, terminal part of posterior cutaneous nerve of thigh and the posterior division of medial cutaneous nerve of thigh. All these structures pierces the roof except the posterior division of medial cutaneous nerve of thigh. Floor or the anterior wall is formed by structures arranged from above downwards, the posterior or popliteal surface of femur, posterior aspect of capsule of knee joint, oblique popliteal ligament and the popliteus muscle with the fascia covering it. Next, let us discuss the contents of the popliteal fossa. So the main structures include popliteal artery and its branches, popliteal vein and its tributaries, tibial nerve and its branches. The arrangement of these three structures are important that we will discuss in the next slide. Next, other important structures include the common peroneal nerve and its branches, popliteal lymph nodes, popliteal pad of fat, terminal part of small saphenous vein, terminal part of posterior cutaneous nerve of thigh, and descending genicular branch of posterior division of obturator nerve. Now we can look at the relative arrangement of popliteal artery, vein and nerve in the upper, middle and lower part of the fossa. In the upper part, the structures are arranged from medial to laterally as the popliteal artery, popliteal vein and the tibial nerve. In the middle part, popliteal artery lies deep within the fossa, which is crossed superficially by the popliteal vein, which in turn is crossed superficially by the tibial nerve. So the deeper structure is popliteal artery and the superficial structure is tibial nerve in the middle part of the popliteal fossa. In the lower part of the fossa, the structures are arranged from lateral to medial as the popliteal artery, popliteal vein and the tibial nerve. Finally, let us discuss the clinical importance of popliteal fossa. This region is clinically important because several conditions can affect the structures within it. So first, let us look at how to palpate the popliteal pulse. So to palpate the popliteal pulse, ask the patient to lie supine and flex the knee slightly to relax the popliteal fascia and hamstring muscles. Now place both hands around the knee with your thumbs anteriorly over the tibial tuberosity and your fingertips deep in the midline of the popliteal fossa, pressing gently against the posterior surface of the tibia. The popliteal artery is deep, so firm and steady pressure is required to feel the pulse. Second one is blood pressure changes. So the popliteal artery can be used to measure lower limb blood pressure. Here we can see that the cuff is wrapped around the thigh and diaphragm of the stethoscope is placed over the popliteal fossa. In conditions like coarctation of aorta, the popliteal blood pressure is lower than the brachial blood pressure. Third one is the Baker's cyst or the popliteal cyst. It is a synovial cyst formed in the popliteal fossa due to protrusion of the synovial membrane through the capsule of the knee joint. It usually occurs due to any underlying knee joint pathology like arthritis or meniscal tear. It presents as a soft fluctuant swelling behind the knee that becomes more prominent on extension of the knee joint and may cause discomfort or restricted knee flexion. Fourth one is the popliteal artery aneurysm, which is the abnormal dilatation of the popliteal artery. It presents as a pulsatile swelling. It may compress the surrounding structures and can lead to complications such as thrombosis, embolism, limb ischemia, etc. It can be treated surgically. Popliteal abscess is the localized collection of pus in the popliteal fossa secondary to infection spreading from surrounding structures. Finally, neurovascular injuries. Trauma to the popliteal fossa like fractures, dislocations, etc. can damage nerves and vessels in the fossa, leading to motor or sensory deficits or vascular compromise. In conclusion, popliteal fossa is a diamond-shaped space in the posterior aspect of knee that serves as a crucial passage for major nerves and vessels. Understanding its boundaries, contents, and clinical relevance is essential for both anatomical knowledge and clinical practice.